Hello again, Palmer. My name is Sheila. I'm going to be the nurse doing a physical health assessment on you today. We're only going to focus on 3 areas. We're going to focus on musculoskeletal, we're going to focus on neuro, and first I'm going to start with abdomen. Okay, so first off I'm going to start with inspecting. The abdomen appears flat. There is no bulging or discoloration. Skin is appropriate for race. A little furry, but that's normal. So I'm going to take a listen here and auscultate vowel sounds. It's okay. It's okay. You have 4 quadrants to listen to. Your right lower, right upper, left upper, left lower. Vowel sounds are active in all 4 quadrants. You're then going to take your bell and listen to the aorta and renal arteries. No bruits noted at this time. I am going to do I'm going to percuss the spleen and liver. So the spleen on the left side here, so I'm going to take my finger. Good, and the liver on the right. Good, percussion seems normal. So now we're going to palpate all 4 quadrants lightly, and you're assessing for any pain. In this case, the patient's nonverbal communications are telling me enough that they are comfortable, no grimacing noted. After palpation, you're going to palpate the spleen. So here on the left side, I'm just palpating the spleen. No masses or anything noted, no tenderness noted from patient. Also, I'm going to assess the liver, palpate the liver. So upon palpation, no distension, no masses, nothing noted, and the patient appears comfortable. I'm also going to palpate the femoral arteries, both left and right, starting with the right. Present and present, both I would give a 2+. So then next we are going to assess the neurostatus of the patient, starting with cranial nerves 3, 4, and 6, which is the cardinal field of vision. Okay, come here. So, starting with this, I'm going to have you look up here, and with just your eyes, can you follow this treat? So what you're assessing for is symmetry of the eyes moving from side to side, and 6 different fields of vision, and appears intact in this patient. We also are going to assess the cranial nerve 5, which is light touch. So to the forehead, we're just going to take something soft, which in this case I'm going to use a coaster, and you're just going to touch the forehead for a sense of touch, which is definitely present in this patient. So next we're going to move on to symmetry of facial expressions, which is cranial nerve number 7. So have the patient smile for you. Good. Close their eyes tight or open real wide, just assessing for eyebrow movement, which in this patient are both symmetrical. Next we're going to move on to a hearing test, which is the whisper test. This is cranial nerve 13. And so I'm going to come to one side of the patient, have them cover the ear that I am of the side that I am on. In this case, we'll cover the patient's left ear. I'm going to whisper a number, 45, and have them repeat it back to me. Do the same thing on the other side. You can say the same number or switch the number up if you'd like. With moving on, I'm going to use a light to inspect the uvula. I want to know any with movement with phonation, and then assess the patient's ability to swallow. So this is probably not going to go over well, but let's try it. So with my light here, I'm going to have the patient open up and assess back to the uvula. Good, and there was movement with phonation. I'm also going to have assess the patient's ability to swallow. If you could just swallow for me. Good. As you can see earlier with the treat that he got, that he is able to swallow without any difficulty. So that appears well. So cranial nerve 9 and 10 are present. So now we're going to assess the ability and have the patient stick their tongue out. That was good timing. So with that, the patient's ability to stick their tongue out was good, so cranial nerve 12 is intact. You could also have them push their tongue against the side of the cheek while giving resistance to both sides while they do each cheek. So cranial nerve number 12 is good. So testing range of motion of the cervical spine, you want them to turn their head from side to side. So you want them to turn his head this way and this way. Assessment is good for cervical spine, able to turn head from side to side. And I'm going to also have you shrug your shoulders against resistance, which allows us to see that cranial nerve number 11 is intact. So from there, we're going to move on to position sense of great toe. So with this assessment, you would have the patient sit and close their eyes, and you're going to take their great toe and you're going to move it up and down. I need you to tell me if I am pulling your toe down or pushing your toe up. Okay? Down, good. Up, good. You would repeat that on both sides to see if it is on bilateral or equal. We're also going to do light touch. So like I said, you can use a cotton ball or whatever you choose. You just want to assess that the sensation on both sides is intact and equal. Over here and over there. So left and right are equal. Patient states that the feeling feels no different from side to side. We're also going to test patellar reflexes. So having the patient sit, come here. And then you want them to relax their legs here. And then you're going to take a reflex hammer and tap to see movement, which is present, and you would do on both sides to test bilaterally. You're also going to assess for bicep, triceps, and brachioradialis. So for this, using a reflex hammer, to do bicep, you would hold the arm in a 90-degree angle from the elbow. So when you do this, you're going to hold and put your thumb into the medial aspect of the elbow, so the inside, and you would take your hammer and tap, and you would do this to both sides, and you're just checking the bicep. Next, you would do for your brachioradialis, you're also going to hold the forearm. You are going to take the flat side of your hammer, and you're going to tap the brachioradialis tendon or muscle, and you should trigger a response. Next, I'm going to hyperextend the patient's elbow, and I'm going to use the flat side of my hammer again and tap a few times, and I'm checking the tricep movement. So all movements, all reflexes were intact for this patient, so everything was normal, and I would repeat the same thing on the other side. Next, we're going to test coordination. In this one, you are going to ask the patient to do finger to then their nose and then back to your finger. So we'll see how this goes. Come here. Hey. Good. Now your nose. My hand. Here. Good. And your nose. Very good. So we will say that the coordination in this patient is present, able to do fingers or hand to hand to nose well. With the Romberg test, this one, we would stand behind the patient. So having the patient stand, we'll have them close their eyes and lift a leg off. And while they lift the leg off, you want them to take another hand and go to their nose. With that, the reason you want to stand behind them is because it's very common that patients will lose their balance during this time. In this patient, he was able to lift his leg and touch his nose appropriately, so he was able to complete a Romberg's test, so I guess is negative. Next, we're going to move on to muscular. Assessing the trunk, shoulders, extremities, and of a standing person. So when Palmer stands, his trunk appears symmetrical. Shoulders are in same line and symmetrical on both sides, no changes or distortions noted. Extremities appear to be the same length, both movement present in both. So now we're going to check range of motion of the shoulder, including internal and external rotation. So with this, come here. You want to see the patient be able to move their shoulders up and out and inward without any tenderness or pain in that time. So they should be able to lift all the way up and come all the way back down. You also want to see them rotate their arm all the way around on both sides. And in this patient, it is present for, So then we're going to move on to range of motion of arms and hands. So if the arms are big, you really want to see a bend in the elbow. So if they can bend their elbow all the way up and then back down, good, Palmer. And chesting hand, you want their wrist to be able to move up and down. You want their hand to be able to open all the way up and close into a fist, which is present for this patient. Next, we're going to move on to strength resistance. So with abduction and adduction of the arms, you're going to push against their arms. Palmer, can I have you move your arms out for me? And they should be able to push well against resistance. And then when they come back in, you want to have them bring their arms in towards their body against your hands. That's good, Palmer. So this is present in the patient. Strength is grade 5 for this patient. Next, we're going to okay, sorry about that. My screen went blank. Next, we're going to move on to the inspect and palpate the spine. So, I'm going to have the patient turn around and have them bend over. I'm assessing if the hips are asymmetrical, which in this case they are not. And I'm also going to feel the spine all the way down. No curvature noted or pain noted from the patient. So next we're going to move on to movement and motion of the pelvis. So we were able to see that Palmer could bend over okay. So now we're going to assess turning. Good. Good. And you also want to see lateral movement from side to side. Palmer does this well. No pain or irritation noted. There's no distortion noted with each movement. Next, we're going to move on to the gait. So, patient's walking, fine. It seems heel to toe looks good. Able to put one foot in front of the other. And his posture is upright. No shuffling noted. Gait is steady. Next, we're going to move on to, whenever they do this, you also want to be able to see them do like a shallow knee bend or a duck walk. So you can have a patient stand and almost do like a half squat, and that would indicate that just the ability to bend at the knees. So we'll see if Palmer will do it. That was kind of it. Good job, Palmer. That completes the assessment for today. Thank you for your time, Palmer. I hope I was able to provide you with the appropriate assessment that you needed. And thank you, guys.